All right. Hello, everyone. This is the third edition to the new initiative to Psychotree, where I'll be interviewing teen mental health specialists to gain a better understanding of the therapy and intervention side of teen mental health issues. So today I'm joined by Dr. Taunya Tinsley, and she's otherwise known as Dr. T. That's how I like to call her. And she is a licensed professional counselor and the owner of Transitions Counseling Service, LLC, and Life Skills Program, providing HIPPA telehealth counseling throughout New Jersey, Pennsylvania, and Ohio. This includes a ministry division called the Love and Basketball Ministries, where she focuses on biblical, historical, and theological foundations as they relate to culturally relevant ministry development and coaching culturally diverse populations, including the athlete population. With a deeply rooted passion for helping those around her, Dr. T's many specialties include the areas of adolescent and adult development, sports counseling, spiritual and Christian interventions, and multicultural issues in counseling and in training and development. So thank you so much for joining me today, Dr. T. It's such a pleasure to have you here. And just before we start, I was wondering if you could quickly just introduce yourself in your own words and explain why you chose a career in psychology.
Absolutely. And Shrivi, I'm just thankful. I am humbled and honored to be here with you today. As I shared with you before, I had another high school student reach out to me to interview, and I am just applauding the fact that young adults, high school students are looking to be mental health advocates. And so thank you for having me on your show. One of the things that I want to clarify first, because oftentimes, the word psychologist is encompassing. People use it to encompass everyone. So let me just share, because I'm not a psychologist. I am a PhD level professional counselor. Yeah. So although psychologists, counselors, social workers, we all do the same, we are all trained differently based on our academic disciplines. So I want our listeners to know that you might hear of a psychologist who's licensed. You might hear of a licensed professional counselor who has PhD level. You might hear of a licensed clinical social worker, and you might hear of a licensed marriage and family therapist. And although we overlap in the work that we do, we really have a different professional identity, how we identify with our career. So for me, I chose counseling versus psychology, one, just because of the training program. Two, where I was mentally and emotionally when I started the program, when I was seeking counseling, I wanted someone who comes from a holistic perspective, a wellness model. So we as professional counselors come from a wellness model. So we have to understand diagnosis. We have to understand the biological implications of somebody's mental health. But I really like coming from a wellness model where I am looking at the well-being of an individual first, and then looking at what might be contributing to any of their depression or anxiety or trauma from a scientific medical perspective. So you may have psychologists that come from a medical model. You also have psychologists who do come from a wellness model, but I chose counseling just because of the focus. When I went to Duquesne University in Pittsburgh, Pennsylvania for my PhD, it really was encompassing of who I was personally and how I identify and view a person's health and their emotional health and their spiritual health.
Oh, okay. I actually didn't know that. That's really interesting how you
Yes.
like combine all these different things together. Because I just recently interviewed Dr. Bell. He chose the more wellness model, I think, and like just listening, because he said like sometimes there doesn't have to always exist like the medical model in his eyes, because people are people. So I applaud like the different kind of avenues that you're using in order to still reach like a solution for all these people that you're helping. So yeah, it's really important to keep in mind that there's not just one way to help somebody in this case.
Absolutely. And prior to me starting my doctoral program in counselor education and supervision, I have had previous counseling. So I've had a previous counseling when I was right out of college. So I was in my early 20s. The counselor I had was a psychologist who came from a wellness model. He looked at the systemic model and the family system model. So I got experience from that. I also met with a professional licensed clinical social worker who came from a medical model. So when I was dealing with some transition issues in my life and career, and the transitions was causing some anxiety and depression, one of her first go-to was medication. I'm okay with medication, but I don't want that to be the first go-to. So
Yeah.
when I started my doctoral program, when you asked me why I chose this career, this was not initially my plans, Ribby. In 2002, I lost my brother suddenly and traumatically to gun violence.
Oh.
And I was in Pittsburgh, Pennsylvania. I'm from Minneapolis, Minnesota. So not being home with my family, that was a challenge in itself. Two, I feel like everybody grieves differently. So no one person's grief is like another person's grief. So I needed to be in Pittsburgh to be able to deal with my own grief. I also found that I was very depressed. And when I finally made the decision to go to counseling in Pittsburgh, I had some certain criterias. I wanted somebody who maybe looked like me, Black or brown, but could understand the cultural influences.
Mhm.
I wanted somebody who might be able to integrate the spiritual and Christian perspectives. I really wanted somebody who understood the family system, right? I couldn't find that one person. And that's when I got the call to say, oh, that's you're going to be that one person, and you're going to train other people to be those people out there. And that's how I got into this profession.
Wow, that's really inspirational. I'm so sorry for your loss, but
Thank you.
that I applaud you for going and seeking help, and also just now inspiring other people to do the same. So
Absolutely. Thank you.
that's amazing.
Thank you.
And so, just on the note of the job that you do, what does like a typical day look for you as a counselor?
So let me go back to, because my doctoral program very unique. So if people were to do a Google search and find PhD programs or Psych D programs in psychology, I chose a PhD in counselor education and supervision. So the program was preparing me to do five things. One, to be a clinical counselor. Two, to be a clinical supervisor. To be a counselor educator, where I am training counselors. It was preparing me for research and publications, for writing, right? And then also for leadership and advocacy. So on any given day, I'm doing one of those five things.
Wow.
So depending on the day, I could be teaching a master's level counseling course, preparing students for the field. I could be providing clinical supervision to master's level students, or for those who already have their master's and they're seeking licensure in the states that I'm licensed. So I have 3 supervisees right now, where one is in Pennsylvania because I'm licensed in Pennsylvania, and 2 are in New Jersey because I'm also licensed in New Jersey. I'm very I am an advocate. I want to empower. I really want to talk about the importance of cultural competence. So my leadership, whether it's locally, statewide, nationally, or internationally, I'm using my platform to bridge the gap between faith and mental health. I'm using my platform to help people to understand the biases and stigmas and barriers, and really kind of trying to decrease those stigmas, but increase the importance of help seeking behavior for unique cultural groups, people of color, the athlete population, and those who might identify with a faith or spirituality or Christianity, where there's historically been this barrier for help seeking behavior. So on a given day, I could also be seeing clients. So it just depends on the day, but I love it because I have a diversity and a variety of experiences in each of my day.
Wow, you do everything. That's crazy. Yeah, but it's so inspirational to see like how you do all these different things in advocacy. Like that's kind of what I want to do.
Yeah.
No matter what field I want to pursue, because even if it's not mental health, I want to be a mental health advocate, right? And
Yes,
it's really cool to see how you're tackling all these different things.
absolutely.
And so on that subject, what exactly did you do as far as like education and training to get to this area where you could do all of these things?
Absolutely. So let me kind of start back. My undergrad degree, I went to Augsburg College. It's now Augsburg University in Minneapolis, Minnesota. I was raised in order to be successful, you have to make a lot of money. So in my mind, I went to school to major in business with this idea that's coming from my family of origin, you got to make a lot of money. Now, initially, I wanted to do computer science. I love computers. However, that math and the science piece, those were not my gifts. So I chose business management and a minor in economics. I was also a college student athlete. I was a knucklehead student athlete to start off with because I was so happy to be away from home that I had my priorities wrong. I played basketball and I went out, and I played basketball and I went out. I did not know, I didn't have a mentor or someone to help me to understand eligibility and continuing eligibility. So my grades suffered. And when they told me that there could potentially be concern about me playing, I was like, oh my gosh, let me focus on my academics. It took me 5 years to complete my degree. I had completed all my requirements for my business. So my last year at Augsburg, I took psychology courses. I loved it. I was like, why didn't I know about psychology? So I was really trying to see how I could blend that into the work that I do. I then went on to University of Iowa, and I got a master's degree in higher education administration, college student development, because I knew I wanted to work in higher education. I wanted to work with the athlete population. I wanted to work with students of color with not just recruitment to the school, but retention and graduation. Most people focus on recruitment and they don't do the things in between in terms of retention to get to graduation. And so that was my focus at University of Iowa. I was working college athletics at University of Iowa. I, at that time, thought that I might want to become an athletic director. So if you want to work in athletics, you want to move up, you have to be willing to move around. So I left University of Iowa, which was Big Ten. At the time, I went to University of Pittsburgh, which was Big East. I worked in the athletic program there. Then I got an opportunity to go to University of Maryland Eastern Shore, which is a historically Black college and university. I loved it, but I was there when 9/11 happened. That was a really uncomfortable feeling for me because I was very far distance from the Midwest from my family because the bridges shut down, the tunnel shut down, and I was kind of isolated and alone without my family. So I made the decision to get out of athletics, and I could have went anywhere. I could have went back home to Minnesota. I could have went to Iowa, Illinois. I ended back in Pittsburgh. When I got back to Pittsburgh, that's when I lost my brother suddenly and traumatically. That's when I made the decision to get the PhD in counselor education and supervision. Since then, because I knew I wanted to integrate spiritual and Christian perspectives, I knew I needed to get a theological and biblical foundation. So I got a certificate in missional theology with then biblical theology, theological seminary. And then I also received my doctor of ministry at United Theological Seminary. So it helps to really provide an expertise for the work that I do. So depending on, I'll give you an example. Last night, although the focus was Bible study, we were talking about the concept of forgiveness. Even though I was coming from a biblical and theological foundation of forgiveness, I weaved in the psychological aspects of it and the counseling aspects and the impact of the consequences of forgiveness on a person's mental health. Having the training that I have allows me to weave all of those disciplines depending on the population, the individual, the family, or group that I'm working with.
Wow. Okay. So yeah, that's a great way for people to actually like use these things like that they believe in. Like I'm Hindu and I know a lot of like ideals, and sometimes I wonder how can I integrate this into my life, and I think that what the job that you're doing is helping as well with those people who are like very religious to help integrate the teachings of God into their own life. And I think psychology is an important aspect of that. And I haven't even like understood the aspect that religion could play as much. And now I'm seeing through what you're saying how it helps people, like a specific group of people, and that's really cool to see all these different avenues of how psychology can impact different people. So yeah.
Absolutely. So go back to the wellness model. So SAMHSA has this diagram. It's the 8 dimensions of wellness that makes up a person's well-being.
Mm-hmm.
One of the dimensions is spirituality. So if
Mm,
we are going to focus on a person's well-being and their wellness, then we have a duty to weave in whatever their belief is, their faith tradition, and understanding that in the process.
yeah, that's yeah. And I know that there are like 8 intelligences that psychologists developed. I can't put my finger on his name right now, but
Yes.
there were like 8, and one of them was like a spiritual,
Yes.
intelligence. So yeah, it's
Absolutely.
very important to also take that into consideration.
And that
So
that's a cultural competent clinician then, or a psychologist or a professional counselor when they are able to do that.
yeah, exactly, exactly. And the final question that I had about your job
Mhm.
was, what do you find to be the most rewarding experience, and what do you find to be the most challenging experience within your job?
I like that. The most rewarding is when I am able to witness or hear about later a person's growth and transformation. I'm all about helping individuals, families, groups, and organizations with self actualization. So if I can see it while I'm working with someone, if I get an email years later from a former student and said, "I finally got what you were trying to do, Dr. Tinsley," then I'll that warms my heart. But I also sometimes I plant a seed, and my job is just to plant a seed, right? And to start nourishing it. But to see that seed sprout and grow and bloom. So even in 2007 to 2009, when I was in Pittsburgh working with my pastor to help faith-based leaders with helping them to understand the importance of mental health, it took some time. But when the pandemic hit, wow, my pastor and I had so many faith-based leaders reaching out. We need to talk about mental health. It's impacting our congregants. It's impacting me, all of the losses. And so I look at a crisis situation as an opportunity for growth. So even during the pandemic, when that happened, that was something that I could see the transformation, the growth. Now, what's the most challenging? Um, Oh, there could be a different things. The first thing that pops in my mind is not everybody is designed to be a counselor.
Mm,
So, working with students who are struggling with their own self-awareness, when they're struggling with understanding the counselor as a person and counselor as a professional. So that's challenging. So that just trying to help guide that journey and that process for them. Although I engage in research, in writing, and evidence-based writing, um, and it's important for me to write manuscripts and book chapters and a book. Writing is not my favorite. That of those 5 areas, the research and publication is probably the most challenging, but it is rewarding after it's done.
yeah, that makes sense. I think even for me, I completely agree. I mean, especially when you're like so interested in like psychology, which is like human behavior, and you want to interact with people, and you're
Mhm.
forced to like just be like writing up a book or a manuscript. Like I totally understand that, but it's still an important aspect. And yeah, I do see how what you said about the patients sometimes being a challenge when they can't exactly understand what's happening, or be able to put themselves out there, specifically understand their own feelings. And it kind of connects back to what I've heard from some of the other people I've interviewed, and even within just healthcare professions, is that a lot of times it's the solution to the patient's problems can only be found by the patient. We're just here to kind of guide them to the answer. So
Absolutely. You're sounding like a counselor already.
thank you, thank you.
Yes.
Yeah. So now I wanted to move towards patient care. And
Yes.
I know you said that you utilize a bunch of different aspects in order to help a patient. So what exactly is your methods of diagnosing a patient?
Absolutely. Well, first, let me talk about um, my theoretical approach to counseling,
Yeah,
right? So
sure.
every clinician, whether it's a psychologist, a professional counselor, we all have a theoretical approach. I come from a humanistic perspective. So
Okay.
I really weave in that Maslow's hierarchy of needs. So
Yeah.
you heard me talk about
Yeah. Yeah.
self-actualization. Even when I'm working with a client, I got to assess where they are on that hierarchy because they're not going to be able to self-actualize if they don't have their basic needs met, right?
Mhm.
And is having a lack of their basic needs contributing to their mental health challenges? So I also come from a person-centered approach. I'm a true believer that it is important to develop effective cross-cultural therapeutic relationship. My clients are not going to care what I know about a theory, about diagnosis until they know that I care.
Yeah.
So even my approach to counseling, coming from a person centered, unconditional positive guard, right? Genuineness. And I'm building that cross cultural therapeutic relationship because as I develop that relationship, that is then opening the door for the client to feel more vulnerable and transparent in a safe place. I also come from an existential perspective because I want to help my clients to make meaning of their experiences. It is those challenging situations that help a person to grow. But I also, depending on the presenting issue, will dip and dab into other theories. So if I'm working with families, it is really important for me to weave in family theories and systemic theories. If I am working with someone where we got to change their thoughts about something, I might use cognitive behavior theory or rational emotive behavior theory. So I'm grounded in the humanistic existential perspective, but I dip and dab in these other theories, whether they're family system, whether they're the cognitive behavior theories, and even the multicultural theories. So I build the therapeutic relationship. I really, assessment is just not a one time thing. Assessment is happening in each of my sessions. Is that as I'm developing the relationship, I'm getting more information. So here's how I kind of explain it to my clients. I want you to think about I'm putting a 10,000 piece puzzle of your life together and I'm listening to everything you're saying, and some of your puzzle pieces are from your early development. Some of the pieces are about where you see yourself in the future, and some of your puzzle pieces are in the here and now. I come from this perspective that early development impacts later development. So I'm really trying to put the puzzle pieces together of their early life to understand the here and now, because we know that there is this concept called adverse childhood experiences that can impact adults. It
Yep.
can impact anybody across the lifespan. So I'm also assessing, are there any childhood experiences that could be influencing the presenting issue that my clients are experiencing today? So building that relationship allows me to put that puzzle piece together, allows us to go deeper and shine a light on what's going on below the surface so that
Mhm.
that person can then talk about it and begin the healing process.
Wow. Okay. And honestly, that one like huge thing that you just said like encompassed a bunch of questions that I had because
Okay.
I was gonna ask like what are the different types of therapies and things that you do
Yep.
based on the different needs of your patients. And you just said like you use cognitive behavioral therapy sometimes for specific patients, or you
Yes.
take a more like family-based approach because that's important to them. So I think you bring up a really great point that it it only matters based on the specific patient, because what works for one patient definitely that necessarily would not work for another patient, and it's
Absolutely.
important to listen just like you said and piece together that puzzle in order to understand what is the best way moving forward. So that is a really cool way that you explained it with the
Mhm.
puzzle pieces analogy, because I definitely do think it's important. Like childhood development for sure is definitely important, even though it's like much harder to understand.
Mhm.
As a professional or someone who's more like self-aware, it's a little easier. Like you can like piece together like some of the things in your childhood, but obviously it's not. It's a little more distant for most people seeking help. So yeah, it's really important that professionals like you are bringing up that aspect as well. So I applaud you for that.
Thanks.
So yeah, that was basically my questions about your patient care. You kind of
Right.
encompassed everything, and that's awesome. And so I just wanted to ask, what is the main demographic that you work with?
So, I have a diversity of clients that I work with. So, I work with adolescents all the way up to later adulthood. Children, if I'm doing family counseling, that's kind of minimal, but I say that I start off with those who are 13 and 14 and above. Um, and then, I have I think about all counseling is multicultural counseling. So
Mhm.
I don't just see clients based on their race or religion. So I have a diversity of clients based on various aspects of culture. And I define culture broadly in this sense right now. So, however, depending on who comes in, then I am understanding them from a cultural perspective and the intersectionality of the cultures that they bring that makes up their personality.
That is so important because, and I just kind of like put a light bulb in my head of something that I've been researching for some time, called the model minority myth,
Mhm.
as far as with Asians, because I am Asian, and I've seen that in my school, and like I've seen a bunch of articles saying like the best way to fix that kind of thing is with the culturally based approaches with like counseling, or with these kind of interventions, with these mental health interventions. So it's great to see someone like you practice that, because that is honestly so important. So thank you for doing that. Yeah.
Yes, yes,
So because you explained that you work with adolescents, now let's move into that, because I'm an adolescent, and that is
absolutely.
my main area of advocacy, because I can understand them the most. So
Yes.
what are the most common issues that your adolescent patients come to you with?
Absolutely. Great question. So I've worked with adolescents who are dealing with depression, transition from middle school to high school transitions, transitions with friendships, because as you get older, you're moving from these large peer groups that you have in elementary school and middle school to now very, we talk about cliques in high school and just kind of your friendship group and social relationships. And adolescence is a time for identity development.
Yeah.
Who am I as a person? Who am I as I move forward in life? So, we're talking about identity in terms of career identity. So, trying to figure out, adolescence is that last stage before you're in the world, this thing called life, right? In the world. And what am I going to do with my life? So really kind of focusing on identity, career identity. um, I'm, I've worked with high school students that are dealing with parent conflict because in adolescence that's where it's really
Yeah.
strong.
Mhm.
And I try to also work with my parents and caretakers with understanding that adolescents are now trying to exert their perspective and ideology. But I also know that the research shows that what parents are depositing into their children and adolescents, it will come to fruition. But this is a time for adolescents to test their own authority. And that's challenging for parents. I'm helping adolescents with becoming interdependent and not so much dependent on their friends, their social groups, their peer groups. So it can be anything from transitions, parent, adolescent conflict. It could be depression. It could be anxiety. It could be what am I going to do with my life after high school? So there's a variety of issues and challenges that I might be working with them.
Yeah, wow. And those are a majority of those are ones that I've seen other people deal with, or I myself deal with. So
Yes.
yeah, it definitely hits close to home. So as far as with your patients, how exactly is your approach to them? And is it different from adults? Because I've heard from others that the basic thing is just having like empathy and building that rapport, because it's important to show that you are a human. So do you take like any different approaches for adolescents, or is it about the same?
It's about the same. Remember, people don't care what you know until they know that you care. And when
Exactly.
I'm working with my adolescents, I'm an adult. And so my adolescents may have this unspoken statement. How is how you're going to treat me in the counseling session any different from how my teachers treat me, how my coaches, how my parents? And so I really have to take in consideration I am adult and I need to build the relationship first to know that I am on this journey with the adolescent. So I may do that. I have had clients who love music, and sometimes it may be challenging for them to verbally communicate their emotions and thoughts. So I'm open. Let's use music. How about you create me a playlist on YouTube? I'll listen to it and listen to the words, and we'll use that as a guide in our discussion. So I want to get to know my adolescents. What I had adolescents who love the video games. All right, I'm not a video game person, but tell me what I want to learn, and I'll do my own research so I can help to understand what the presenting issues. And then now we can put some words to what is going on in that person's life. So it's really important listening, the empathy, unconditional positive regard, non-judgmental. I want my adolescents to know everything we talk about is confidential. The only time that I am going to disclose is if I'm concerned about your safety or someone else's safety. But I also help my parents to understand that, and that my goal is to strengthen communication between the adolescents and parents. So there may be times where I'll ask the adolescent, is it okay if we bring your parents or caretakers in and we can talk about all together what's happening, and I can help guide that discussion.
Wow. So you definitely go above and beyond for these guys. That's
Mhm.
amazing. That's amazing. Especially, I have never heard of a counselor or anyone, a therapist like that, like listens to a playlist from like a patient. That's amazing. I would love to, have help from someone like that, because I think that when you're a teenager, like it's kind of you're kind of like, oh, how is this person going to help me when they're not necessarily facing the same things as I am, when in reality, like, we've all been teenagers at one point. So it's
Right.
definitely, you've definitely understand. It's just
Yeah.
that it's harder to build that connection immediately, as whereas an adult, like, they go in knowing like, yeah, this person is a professional, whatever, they can definitely help me. But
Right.
yeah, it's harder with adolescents, I think, and I think you can say that as well. But it's so great to see someone like you, like, taking that extra step, because that's where it matters the most. Like, if someone can show that they care just that little extra more percent more, then
Right.
that's where, like, that trust is built, and that's where, like, so much more improvement can happen. So
Yeah.
that's great.
And I'll say this, if there are any adults listening to us now, if there are any other clinicians listening to us, what I am saying to Shrivi right now is nothing that we don't do in our training programs. We are trained to be multiculturally competent. It is important to be us, for us to be aware of our attitudes and beliefs, but we need to be knowledgeable of the culture and the values and the beliefs of the clients that we're working with. For those clinicians and those adults, we use development. We talk about the developmental stages. We need to understand the developmental stages. We can't expect a 16-year-old to be in the stage of an adult when they're not there yet.
Yeah.
So we have to meet the client, meet the adolescent where they are, not where we want them to be.
Wow. Thank you for that. That was great. And I really do hope that gets to the people that need to hear it. So
Yes.
thank you. And you answered most of my other questions, which was like, how do you involve parents or guardians? And you explained how it was when you see a threat to the adolescent, and that makes complete sense. And it's important that you're keeping confidentiality otherwise, because that's, I think, a really big part of showing that you care. And the kind of last thing that I wanted to talk about with teens was, could you just share, like, maybe one specific success story that you had with an adolescent? So just so we can see, like, how you deal with that.
Absolutely. So I tell you, I get those emails when somebody's gotten that aha. And I think about one of my adolescents that was living in a community. And so that's where we have to understand the community context on the impact of the adolescent. And they lived in a community where there was a lot of violence, and they experienced a lot of grief and trauma, right? And so when we talk about trauma and grief, and the impact on the person and the prolonged grief, to really see this young woman as an adult now and the work that she's put in, because it's a journey, it's a process, it's not a destination, and to be open to continuing to work on herself from 16 years old to now she is in her late 20s and is still continuing to work on the impact of the community on her mental health. That's a great success story.
Yep, exactly. When you can equip them with like skills that they can use for the rest of their life, that's when you know it really did make an impact. So
Yeah.
that's awesome. So yeah, that's my questions for teenagers. So now let's move on. I only have like 2 seconds left, so it shouldn't take too much more time.
Okay.
And we have been running for quite some time, but it's been super interesting to hear everything from you.
Yeah.
So just like a few questions for mental health advocacy,
Yes.
for those wanting to, help, just like how I'm helping and how you're helping. What advice would you not only give to advocates of mental health, but just to anyone in society, just so they can learn, like, just to get rid of any misconceptions that they have about mental health? What is like some advice you'd give them?
Absolutely. Well, first of all, I think one of the misconceptions is we need to understand the difference between mental health and mental illness. We all have mental health, right? Just like we have physical health, we all have mental health. But there
Exactly.
is a certain percent of the population that have a diagnosable mental illness that's diagnosed by a trained professional. So I think I want to help people to understand all of us have mental health, we all have well being, we all get stressed. There are some good stressors, but then when it is too much stress, it can impact the cortisol can impact the serotonin in our brain and can impact our motivation and our mood. And so it's really important to understand that mind and body are connected, and what is going on in your life can impact your wellness and well-being, but that doesn't necessarily mean you have a mental illness, right? So I
Mhm.
want people to know that. But then if somebody has a diagnosable mental illness, that they can still live a productive life with treatment. And so I want people to understand that, is that you still can live a productive life if you have been diagnosed with depression, as long as you're in treatment and utilizing your toolbox, or depression or trauma. So I think we need to help people to reimagine this idea that somebody diagnosed with mental illness can't live a productive life. You can.
Yeah. Yeah,
Yeah.
and I think within mental health, like you have with regular health, you can have like a cough or a cold, and people will still like do these things to get rid of it, or
Yes.
maybe the flu, and that's not like a permanent thing, not like a permanent illness, but you still have to do things in order to get rid of the flu. But when
Yeah.
it comes to mental health, there's only like two extremes that like society has put. It's either that you don't have any mental health issues, or you have all these mental health illnesses like depression and things like that. But that's not
Right.
even the case. There's a whole spectrum,
Yeah.
like you can be facing with like some stress. You might not have like general anxiety disorder or anything like that, but you might have some anxiety, and
Yeah.
it's okay to actually seek help for those kind of things, because it doesn't have to reach like a certain area where you have like a disorder in order for you to seek help. Like we see in society, whenever I've gotten like a cold, like a fever or something, I still go to the doctor. So it's like
Yeah.
the same thing like that. So if someone is
Absolutely.
stressed out, they can still go and seek help from a professional.
Absolutely.
And also for people with these diagnosed disorders, they also have to realize that just like other illnesses, we can get through it. So that's like,
Absolutely. Absolutely. You sounded like a counselor, Shuyi.
yeah, it's just something that I've realized, because, it's important for everyone to realize that they can get help and that
Absolutely.
their life will be okay. That's the
Absolutely.
biggest thing. So,
Yes.
yeah. And within society itself, what do you think that like communities can do, or schools can do, and workplaces, all these different places can do to better the mental health of people that go there?
I think one, again, using their platform to talk about mental health in the workplace, mental health in the community. I think we need to come from a collaborative perspective. So when we talk about there's this new concept called healing centered engagement, right? Sean Ginwright talks about we all have to collectively work together. whether there needs to be a school, community, connection. We can then weave in churches and faith-based organizations that we're all collaboratively working together.
Yeah, that's really important important thing that you brought up. And just like something in my life, I know I reached out to my principal about like, having mental health things in our school. And he just told me that like this summer, the school district committee realized that mental health was a really big issue. So that's one of the district goals. So I'm
Yes.
really looking forward to helping my school district this year and to advance that and maybe bring some workshops to school and things of that sort in order to help the students, because the thing in school at least is that they think that it's a big thing where it's like, oh, mental health is really extreme, we shouldn't talk about it because it's so sensitive, and because of that we aren't even equipping students with basic self-awareness skills and emotional learning skills. And so now they're kind of just kind of lost, even though they could have these basic skills that don't have to reach the extremity of like suicide or anything like that. But I think any aspect of mental health, just like I was said, it's not like an extreme one side or the other. There's a whole spectrum of things. And so I think it's important for communities like schools or like churches, like how you help through like ministries, things like that, where they're also providing help. So that's really important. It is a community.
I am so glad to hear your school is doing that. I will also say that that's a statewide initiative from the Department of the Department of Education in New Jersey, is because we need to understand the role of school counselors. We
Yeah.
need to understand the role of school-based mental health professionals, outside agencies that come into the schools to help with that education. So I'm glad to hear that your school is doing that.
Yeah, I'm glad as well. It's great to hear, and I'm looking forward to it. So now for the final aspect of what I want to learn from you are just some personal insights from you. So first, how do you manage your own mental health and well-being given the demands of your job and also the fact that you're tackling like 5 different aspects of your job?
Absolutely. I think that it is really important for me to manage it. I got to pay attention to my body when I'm starting to feel like I am getting burned out. If I'm stressed, I need to be able to say no. So, one, managing my mental health is to be able to say no, not yet. I need to focus on me. I have to write myself in my own schedule. Now, I'll be honest and transparent. When you asked me if we could move the time today, I was like, yes, because the afternoon I have scribbled it out in my appointment book and wrote Taunya Tinsley in there. So I can do whatever I want to do, but I just need to be able to breathe. In our field of counseling and psychology, burnout is real.
Yep.
And I need to make sure that I am not burning out so that I can effectively be there for my clients and for my students and those that I consult with. So I say no, I set boundaries. Mental health, I'm sorry, self-care is not a luxury. It's an ethical mandate. And so I want to make sure that I'm modeling that for those that I'm working with. So today I'm excited because I love to clean. That's therapeutic for me. So to block out my schedule and clean, it allows me to just think. It allows me to relax. I know some people are like, cleaning is a mental health strategy, but that is for me. I have the music on and I get it done and I feel like I'm accomplishing something. But I also just rest my body. So I take mental health seriously, and even coming out of the pandemic. So I have this statement that I tell others that I also live. Self-care is a courageous act of justice.
Wow. Yeah. And you have inspired me. I want to clean my room now. But yeah, for sure. I
Yeah.
definitely agree with that, because if you like, some people have this misconceived perception that like success is all the things that you do throughout the day and you have to be doing something all the time. Otherwise, like you're not going to get there. At least that's something that I've like a bad mindset that I developed early on, I think in high school, and I'm still trying to get out of that. But yeah, it's so important to take some time for yourself and rest, because otherwise, of course, you're definitely going to burn out. Yeah, that is a real thing, and it's definitely impacting workers around the world in healthcare, especially in mental health specialties. So yeah, I applaud you for taking some time to yourself, and I'm glad that now you can have like the noon to yourself. I'm sorry, I didn't know that. So
No, that's okay. That's okay. It worked out.
But it worked out. Yeah, we got to schedule at
Yes,
11
yeah.
instead.
Yes.
So yeah, that's really important.
And
And
please don't be sorry, because what we're doing is important. And
yeah,
this is important as part of that advocacy. But I know for you and I both, you just came off of vacation, and I'm so glad you were on vacation, right? And so I think we take care of ourselves,
mhm,
but we also do those things to help the other people. And you're
exactly.
doing a great thing by helping your listening audience with understanding mental health in the different professions. So, yes.
Thank you. I appreciate that. And just two more questions that I have. So one question is, what do you wish that more people knew about mental health care and like the work that you do?
Um, that you don't have to have a problem to come see us. You
Hmm.
could just have a safe space, a confidential place to just release so that you can go back out there. I also want people to know, don't get discouraged. Right now, yes, we are in a mental health pandemic, and many clinicians, there might be waiting lists, or that, it may take a minute. Don't get discouraged. Don't give up. And if you reach out to someone and they say they are full, ask them if they have a recommendation for someone else, because help is out there. And I also want people to know you're not alone, that you have support, and there are people that are here that are willing. Reach out to one of us, right? If they're not sure, they can reach out to you, they can reach out to me, and we can help them to get connected.
Yep, exactly, guys. Whoever's listening, we can definitely help you. Yep.
Yep.
And the final thing is just for anyone. What are some simple techniques that you would recommend that people do in their daily lives to maintain good mental health?
I would say eat properly, because sometimes when we're on the run and the students, and we got to go to practice, we got to go to this, we got to
Yeah.
go to that. But I would say eat healthy, make sure you get some exercise, and get some good rest, right? We can stay up late at night, but that the lack of sleep can impact us the next day or a couple days down the road. Find out what you enjoy. So self-care could be adult coloring books, right? So I don't know, I love to color, right?
Hmm.
So just coloring. Or you can go to a movie, find something that you enjoy to do, but then also connect with friends and connect with social, because we are not designed to be alone, we're designed to be in relationship.
Yep. Yep. 100%. And I
Mhm.
actually just quickly, I just want to say, like, I remember I saw like this TED talk and it was talking about how do we get rid of like addiction and things like that. And it was like this experiment that they did with rats. And
Mhm.
it showed that eventually the rats, they put the rats in like cages, different cages. One of them was with nothing. And then one of them had like this like park, this rat park. And it was found that the rats that were in the cage with the rat park were much less likely to indulge in like addiction because they were
Mhm.
able to socialize with other
Right.
rats. And I was saying
Absolutely.
like the solution to these addictions is just connecting with others because humans are social beings. So yeah,
Absolutely. Great.
yeah.
Yep.
So that
Yeah.
was really cool to see.
Yes.
So yeah, that's all I had. That's all the questions I had for
Yeah.
today.
Yeah.
So if you have
And
anything else to say,
I
you can
just
go
want to
for it.
say, for those that we just talked about, they could reach out to us,
Yeah.
right? And I know that we'll be connected to our social media platforms, but I'm on Instagram, I'm on TikTok, I'm on Facebook. So please don't hesitate. If you just need some guidance or need some support, if you have any questions on anything we talked about today, please don't hesitate to reach out.
Yep, exactly. And so, guys, once again, that concludes our podcast for today. And if any of you are interested in potentially working with Dr. T for any mental health concerns, could be an actual like diagnosis thing that you want, or just any stress that you have in your life, or if you're just more curious about learning about what she does, I suggest that you go check out her Psychology Today profile, which is how I found her, or her website more so, which was transitionsaalp.com. And I'll put that in the description of this video. And also, she has a YouTube channel, she has Instagram accounts, and I'll link all of her social media profiles in the description of this video as well. So thank you so much, Dr. T, once again for joining me.
You're
This has
very
been a wonderful, wonderful talk, and I learned so much, and I will definitely be keeping in contact with you moving forward. And thank you to all the viewers out there for tuning in. It means so much to me that you guys are supporting these videos, and make sure you follow because I will be interviewing some more specialists in the future. And thank you so much to everyone. Goodbye.
bye.